our first question will be, what is self-medication itself and why it is becoming so highly today?
So self-medication by definition is like we are just taking it from the word itself, self-medication. That is whenever you take medication that is not prescribed by a professional healthcare worker. So you have a headache and then you decided to go by yourself to the pharmacy and take and buy a medication just because you think that medication is going to treat that headache. So that is considered as self-medication. Or whatever medication you take, be it herbal medication or conventional treatment, as long as it is not prescribed by someone that is trained to do so, that is considered as self-medication.
Thank you, Ibrahim, and which is also dangerous as well.
It's very dangerous.
Okay. So, what are some of the danger of self-medication?
So, with the dangers of self-medication, the reason why people are going to school, to the nursing institutions and also to medical school, is for them to be trained and for them to know the indication for this medication. Because any medication that you see, it has an indication and also contraindication with the side effects. They have benefits, they also have their harm or risks. So whenever you are taking a particular medication, the person that is going to prescribe that medication for you, they have to know whether the benefit outweigh the risks. So whenever the benefit outweigh the risks, that is the time that they prescribe that medication for you. That is the benefit, it is more than the risk. But if at all the risk is greater than the benefit, then they do not prescribe that medication for you, but they will prescribe another alternative medication for you. But you who is at home, who has not undergone any training, you would not know whether this benefit outweighs the risk or not. So you go ahead and then you take that medication, not knowing that that medication might even harm you because of your complaint. So that is why when you go to the hospital, they will take your full history, not only your complaints, but even your past medical history or surgical history. Then they will know the right medication that they should prescribe for you. For you at home, you will not know the medication that are even contraindicated to you. So you keep on buying medication and taking them. So that is why as a result, some of them will end up having gastritis, some of them will end up having peptic ulcer disease or kidney injuries just because of the medication that they are taking. So this is one of the things that the side effects that it can lead to. And another thing is like it can lead to another bigger complication. That is, if your kidneys are damaged, it can lead to hypertension, that is high blood pressure, and it can lead to, like, for example, the medication that ladies are taking for weight gain. There is no one that is advising them to take them. So that is self-medication. So if you take that medication, it can lead to osteoporosis. That is, it makes your bone very fragile, so you can easily get fracture. Not only that, it can lead to type 2 diabetes mellitus, because it will keep increasing your blood sugar. And not only that, it can suppress your immune system. That is, whenever you have even a small infection, it is going to affect you. So all that, you can avoid it if you go to the hospital, let them prescribe the medication for you after you take it according to what is prescribed.
So Ibrahim, like these points are very important, and I think our audience will learn something from it. But what did you think is the reason behind this self-medication?
I would say maybe number one is that